Near-death experiences, quantum consciousness, and non-local theories. Near-death experiences, NDEs, and phenomena like acute non-local perception and consciousness, where individuals report perceptions or awareness seemingly detached from their physical body, are subjects of intense scientific, philosophical, and spiritual inquiry. While the exact mechanisms remain elusive, several hypotheses have been proposed to explain these phenomena. Here's an overview of the leading explanations. 1. Neurological and physiological hypotheses. Anoxia, hypoxia. During a near-death state, reduced oxygen levels in the brain, hypoxia or anoxia, can cause altered brain activity, leading to vivid sensations, tunnel vision, or feelings of detachment from the body. Hypoxia has been linked to the activation of certain brain areas, potentially triggering hallucinations or euphoria. Temporal lobe activity. Stimulation or dysfunction in the temporal lobe, particularly near the limbic system, is thought to be responsible for sensations of out-of-body experiences, life reviews, or a sense of connection to the universe. Endogenous neurochemicals. Endorphins and serotonin, these chemicals are released during extreme stress or trauma, potentially producing euphoria, hallucinations, and a distorted sense of time. DMT, dimethyltryptamine. Some suggest that the brain might naturally release DMT during near-death states, explaining the vivid, dreamlike imagery reported during NDEs. Cortical disinhibition. Disruption in normal cortical activity during cardiac arrest or severe trauma can lead to random firing of neurons, creating the sensations associated with NDEs, like seeing light, hearing sounds, or experiencing a sense of detachment. 2. Psychological and cognitive hypotheses. Constructive perception. NDEs might result from the brain's attempt to construct coherent perceptions from fragmented sensory inputs during trauma. These experiences could represent a combination of memories, cultural expectations, and deep-seated fears or hopes. Death anxiety and defense mechanisms. Psychologists propose that NDEs might serve as a defense mechanism against the fear of death, creating comforting visions or sensations. This could explain the recurring themes of peace, meeting deceased loved ones, or a bright, welcoming light. Hyperreal memories. During moments of extreme danger or trauma, the brain might consolidate memories in an unusually vivid way, making the experience feel hyperreal and transformative. 3. Quantum consciousness and non-local theories. Quantum brain hypothesis. Proponents like Stuart Hameroff and Roger Penrose suggest that consciousness arises from quantum processes within microtubules in neurons. In this view, consciousness might not be confined to the brain but instead be a fundamental aspect of the universe. During an NDE, these quantum processes might disconnect from the body, allowing for non-local perception. Non-local consciousness. Some suggest that consciousness is not produced by the brain but instead interacts with it, akin to how a TV receives signals. In this view, NDEs and non-local perceptions occur when the signal temporarily detaches from the body. Information field hypotheses. Emerging theories propose that all consciousness and memories are part of a universal information field, sometimes called the Akashic field or a quantum information matrix. NDEs might represent a temporary connection to this field. 4. Spiritual and metaphysical hypotheses. Soul or spirit-based theories. Many spiritual traditions posit that NDEs occur because the soul temporarily leaves the body. The sensations of floating, meeting deceased loved ones, or life review align with the idea of the soul transitioning to another state. Transcendental experiences. Some interpret NDEs as evidence of an afterlife or higher planes of existence. The recurring motifs of light, unconditional love, and a sense of unity with the universe are seen as glimpses into these realms. Collective consciousness. NDEs might involve tapping into a collective or universal consciousness, explaining why many individuals report similar experiences regardless of culture or background. 5. Experimental and anecdotal evidence. Out-of-body perception. Some NDE accounts include accurate descriptions of events or details that the individual could not have observed through conventional means. While skeptics attribute these to coincidence or memory confabulation, proponents suggest they indicate genuine non-local perception. Cardiac arrest studies. Research during cardiac arrest has shown that some patients report vivid experiences despite having little or no measurable brain activity, challenging the idea that NDEs are purely brain-based. Blind individuals and NDEs. Some blind individuals have reported visual perceptions during NDEs, sparking debates about whether consciousness can exist independently of sensory input. 6. Integrated perspectives. Hybrid models. Many researchers propose that NDEs and non-local consciousness may involve a combination of neurological, psychological, and metaphysical processes. For instance, an NDE might start with brain-based phenomena but also tap into a deeper level of consciousness. Cultural influences. While the core elements of NDEs are often universal, the specific details, e.g., seeing religious figures or culturally significant imagery, suggest that personal beliefs and cultural background shape the experience. Remaining questions. How do non-local perceptions occur without sensory input? Why are NDEs often transformative, leading to profound shifts in worldview and values? Can consciousness exist independently of the brain, and if so, how?